Hi, this is Josh with PharmacistTips.com. Today to talk about bupropion, the medication bupropion, the uses for it, the dosage, as well as the side effects. So the topics I'm going to cover in this video: what is bupropion, the uses and dosage of this common medication, the most common side effects, withdrawal symptoms, concerns, and the warnings associated. So as with all my videos, this is for informational purposes only, not intended to serve as a substitute for your healthcare provider. Always speak to your healthcare provider before you make changes to your medications or lifestyle. So what is bupropion? It's an antidepressant. It inhibits the reuptake of a couple neurotransmitters known as dopamine and norepinephrine. So it works different than the SSRIs, which affect serotonin. In the U.S., it's sold under the brand name Wellbutrin and Zyban. The approved uses are for depression, seasonal affective disorder, and smoking cessation. The off-label, meaning it wasn't studied for this, but over time we found that it helps with that. ADHD can help with that. Bipolar, the depression associated with bipolar disorder, and sexual dysfunction from SSRIs. So some of those the antidepressants that have the effect on serotonin can have some sexual side effects, things like fluoxetine, citalopram, and sometimes bupropion is used to offset those side effects. So dosing for bupropion, the immediate release is usually started at 100 milligrams, or your final dose is typically 100 milligrams 3 times a day. There's a lot of variation in there. Many people can get by on a lower dose. Maximum dosage considered to be 450 milligrams a day. The SR formulation, this is also the formulation that's generally used for smoking cessation. Started at 150 milligrams every morning for 3 days and then up to twice a day thereafter. Maximum dose on the SR typically considered to be 200 milligrams twice a day or 400 milligram daily dose. The XL typically started at 150 milligrams daily in the morning. A lot of folks end up on 300 milligrams a day. Again, it varies, but maximum dose considered to be 450 milligrams a day. So what are the most common side effects? Now you're going to see there's a lot of range in these side effects, and it is dose dependent. So the higher you go on the dose, the higher risk of side effects. Rapid heartbeat or tachycardia can occur in 10%. So 1 out of 10 people could notice some changes in their heartbeat. Insomnia, again, varies from 11 to 40%. Headache, anywhere from a quarter of people to 30% of people who use this can experience some side effect. Now, these can occur initially, and a lot of times they will improve the longer you're on the medicine. So just because some of these occur, it doesn't necessarily mean that you're not going to be able to tolerate the medicine. If the side effect is bothersome, you of course would want to talk to your prescriber, see if they want you to continue or adjust the dosage. Agitation can occur anywhere from 2 to 30%. Dizziness, 6 to 20%. Excessive sweating or diaphoresis, 5 to 20%. Weight loss can occur in 14 to 22% of folks on this. Other common side effects can include dry mouth, constipation, nausea, tremor, and blurred vision. And again, dose dependent, and a lot of times the longer you're on it, it will improve. Other side effects can include anxiety, muscle and body aches, high blood pressure, itching, rash, weight gain can sometimes occur, increased risk of respiratory and sinus infections, cough, abdominal pain, diarrhea, flatulence, change in appetite, either increase or decrease, increase in urination, ringing in the ears, and others. Again, these are less than 10%, so less than 1 in 10 people will have these. What about withdrawal? It's really not considered to have a terrible withdrawal symptoms, although in my experience, most people do prefer to taper down the dose. They feel best if it's not stopped abruptly. And like I said, the symptoms for most folks can be generally mild, but you typically want to taper the dose over 2 to 4 weeks, kind of depending how long you've been on it, how high the dose is. And of course, that's something you and your healthcare provider can work out. Some of the warnings, suicidal thinking, that can occur with any antidepressant. The risk is very low, but we do warn on all antidepressants that can occur. Change in mood, unexpected change in mood, especially smoking cessation folks. You know, they're taking it to reduce the urge to smoke and they may notice some changes in mood they're not on board with, of course, contact the healthcare provider. Seizures. If you've had a history of seizures in the past, this medicine could increase the risk that you'll have a seizure again. If it seems like the best medicine for somebody with a history of seizures, the dose is usually started very, very low and increased very, very slowly. Mania and psychosis. So some of the folks with bipolar disorder, sometimes this can send them in the too far past depression into the mania episodes. Occasionally vision or eye problems, so you'd want to follow up if you notice a change in vision. It can increase blood pressure, so we need to be careful. If we already have high blood pressure, already have some cardiac heart disorders, we need to be mindful of that. Sexual dysfunction, although it's a lot lower risk than a lot of the other antidepressants that can still occur. We want to avoid alcohol. It is just best to avoid alcohol completely with bupropion. We want to avoid sedatives like alcohol, but also like benzodiazepines, things like Valium, Xanax. Now, they are used together sometimes, so under the doctor's supervision, they can be used, but we need to be very cautious about using them together. I do thank you for watching. I hope you appreciate this information. I'd like it if you'd like the video and subscribe to my channel. Go ahead and ask any questions below if there was something about the medicine I did not cover in the video, but you'd like to know. Thank you.